Hi, everybody. This is the second series of the Healthy Root series. And today we're going to talk about the introduction of food map discovery. And we have Dr. Crystal here joining us. And I'm Dr. Mark. And I'll let Dr. Crystal go ahead with her presentation.
All right. So, yes, I think at this point, everybody is aware of who we are. So we'll move straight into, the power of what you take in. And this means a lot, but we're going to try and really hone it into something that's quite specific for you tonight. So when you're 10 pounds overweight, this is going to increase the pressure on your knees. For example, you're going to have an increase on pressure on other joints in your body, but specifically looking at the knees. And this is really important because if you're overweight, or even if you are at a healthy weight, if there's more fat cells that are present in your body, they're also going to prevent the growth receptors that Dr. Mark is trying to help create that healing. So if you want to explain a little bit more of how your injections and how the therapies work with regard to those fat cells.
Awesome. So just back to that point, with one extra pound is going to put about 3 to 4x pressure on the knees. Same thing for when they did the studies, one extra pound is going to put 4 to 5 extra pressure on the lower back. And believe it or not, 1 to 2 extra pressure points on the neck and shoulder. And that was more shocking to people. Say, yeah, but I don't walk on my shoulder. How does that be affected? But reality is, this is what happened with pressure on the nerves. Are very delicate, same as muscle and joints, and so that's why you feel the extra pressure. So losing even 4 or 5 pounds, less than 5 pounds, might be greatly beneficial from a pressure point of view. The other part is when we are a little bit overweight, the those fat cells block all the healing receptors from growth hormone. So in order to prepare, if we're going to do the PRP procedure or the infusion therapy, you want to optimize everything that we do by reducing those fat cells. So basically makes it easier for the healing and recovery to happen more efficiently when we do infusion or PRP.
Yeah, 100%. And I see this all the time in my own practice too, where somebody looks quote unquote visibly thin, but there's not an ounce of muscle mass on them. So what's on them is just all adipose or fat tissue. And these are some of the most metabolically inflamed patients that I end up working with. And so again, what you've mentioned there is really important, that it slows down any healing that we're trying to achieve. So here are some, the next slide here, then we talk about sort of common activities that you can do for 30 minutes and how many calories that would typically burn versus common foods or drinks that might seem harmless, might seem healthy, but you can see how many calories they can call for. So a bran muffin, which is never exciting to eat, like it's dry, it's just not an exciting muffin to eat, but sometimes we eat it because we think, oh, I'm getting fiber, has 250 calories and like sometimes upward as high as 20 to 25 grams of sugar. And that's a completely different conversation to have. But you can see that if you really want to eat that one bran muffin, you're going to have to walk approximately an hour and a half to burn off those calories. And some people are happy to do that. Other people may not have the mobility or the capacity to do that. And other people are just not feeling like they want to walk for an hour and a half. The double is the one that always, I can't tell you how many people I meet will drink a medium double. It's the standard drink from Tim Hortons. And, that's 250 calories and a ton of sugar. And so, Mark, I think, if you want to speak to some of the conversations that you have with your patients with regards to activity and, what they're eating.
So yeah, it comes to a very interesting point with people say, you know what, I'll eat the bran muffin or have the double, and I'm gonna do my exercise or walk or burn it later. And I always give the analogy or the um, for people to understand is the difference between credit and debit. Well, debit, you have some money in the account, then you're allowed to spend that money. Credit is not your money and it's someone's else, and you got to pay interest on it. So let's take it in perspective to what we do. If you say I'm gonna have that double double, well, before, if you have it, then you decide to walk to burn it off, which is about an hour and a half or so. That's called a credit because you ate or drank this stuff before you earn it. Well, what happens if it was snowy, too cold? You couldn't do it. You got dizzy. You got tired. So that accumulates in your body, and I'm not talking about from weight point of view. It's just from a sugar rush point of view. It's gonna affect your healing, increases inflammation, and so forth. So if you're really adamant about having some of the stuff that looks healthy or benign, then earn it first. Do the walking for an hour and a half. If you did only half an hour, then you're allowed and 100 calorie of that sweet thing that you like, whether it's, I don't know, one third of that bran muffin, or just like it will be a single. So that way you kind of earned what you're gonna eat, and it will over time you're gonna basically train yourself. It's really not worth it to do it. Otherwise, I'm gonna be walking all day long or exercising all day long just to have a couple of things of a smoothie or frappuccino and so forth. So those are just examples. But if you think of other stuff, when we talk about the mapping, it will be an eye opener to when you convert everything to activity level. You'll be shocked how much you need to be active just to burn the simple stuff that we eat and take it for granted.
Yeah, and I love how you describe the credit debit system because it's really easy. It's like normal human psychology to say, yeah, yeah, I'll go for that walk, or yeah, yeah, I'll go for that bike ride after I consume that treat, that really great thing. But life happens, life gets in the way, and for whatever reason, it doesn't happen. And so now you're at that deficit. So I like that sort of mentality of, earn it first. If you really want that frappuccino, go for it, but make sure you're doing something, you're including some type of movement where you can balance out that system. And maybe, you don't need the grande frappuccino. Maybe you can have a tall version of it. So yeah, I think that's a really good point that you bring up there.
Yeah, and then the other part, which is really fascinating, if you did it backward, where you had this stuff, then you want to walk, you're always going to feel guilty all day long till you achieve that walk.
Yes.
But if you walked first or you earned it, whether it's walking, yoga, aqua therapy, whatever that is, then it feels more of a treat. And you would enjoy it much more because you earned it. So there's the psychology of, yeah, I earned that stuff, so I'm okay to have it. Even though
Yep.
it's not net, you did the activity and then you kind of have the same thing to top up that tank. But even though it still feels good because you earned it rather than feeling that you're cheating, right?
Yep. And I would also even add to that things, any type of physical movement, so the walking, the aqua therapy, the chair yoga, these things will naturally release off the endorphins, those happy, feel good neurotransmitters, so that you're not chasing the high that you might get from food per se. So you might even notice that if you actually engage in those physical activities first, you might even notice that, like, yeah, maybe I don't need that granola, or maybe I don't need that double double. Like, I feel great right now. So yeah, so that's
100%.
something to consider for sure.
Absolutely, 100%. It might take your mind off it, and you have that fulfillment from the walking or from the physical activity than having it from sugary stuff, for sure.
Yeah, 100%. So on the next slide here, sure, there's the element of what you put in your body food wise has the capacity to empower your body, nourish your body, or it has the capacity to slow down healing. But so does things like sleep. If you're not sleeping enough, if you're having poor sleep hours where your circadian rhythm is out to lunch, that's going to, by default, really impact how quickly you heal. In terms of the quality of foods, if you are putting a lot of processed sugary foods into your diet, you are literally going to be shooting up nice and high and then crashing really low. And so that's where that psychology of chasing the highs and lows come into play. And if you get good quality foods that you cook yourself, that you're able to put together whole foods, it's a very steady level of energy that you're getting all day long, which is also providing an environment for optimal healing. Now, stress levels are massive. And, sometimes, especially practitioners, we can oftentimes say, you know what, it's stress. This is the reason why you're feeling like this, because of stress. And sometimes when a patient hears that, they feel like, well, like I can't have it, there's no control over that. Like, and they feel sometimes disempowered by that. Or they might just feel like, yeah, it's stress. But really and truly, there are so many metabolic impacts when you are in an environment that isn't really supporting you. And so it's learning to, and I hope some of these conversations that we're having really help to empower you to look at your life and to sort of create some modifications where your system becomes resilient and it can rebound from the stress that's around you. And then finally, or not finally, but also the gut microbiome, and this is why we start this program or the protocol with making positive changes with your gut microbiome, because it controls so much. It controls your inflammation, it controls your immune system, your hormones, your mental health, and also movement. You can be in chronic pain, but there's going to be the less you move, the worse that pain will get. And obviously the goal here with the work that you're doing at Arthritis VIP is intended to get you as mobile as possible to live your most authentic, bold life that you can. But a lot of that, we need to get you to move your body to places of comfort as well.
Yeah, so if I'm gonna go with the same steps, I want to give one tip to each one. We're gonna touch those bases, but if you're gonna take about sleep, sleeping in a certain routine, weekdays and weekends are very important. So you set a sleep time, bedtime, and wake up time, and don't take any naps. That will be a start. In terms of the quality of food, you can avoid any sugary stuff. Or reduce it. I would say reduce any sugars, less than 100 carbs per day. Just to start, does not mean that you're going to be stuck for it forever. It's just during that phase of trying to uh, jumpstart your health, or reduce the inflammation and boost the immune system. We want that carbohydrates to be less than 100. Stress levels, what I do, the easiest technique that you might think of, if it's something I have no control on, stressing about it is not going to change the outcome. So what I mean by that, well, it's knowing it's a blizzard. What can I change that? No. Well, you can stress all day long, nothing's going to happen. But if you say I'm stressed because I'm going to be late, well, can I do something about it? Yeah, wake up early, arrive early, don't be stuck in traffic. It's within your control. It's easy. It's much way less stressful to arrive 15 or 20 minutes early to any appointment than trying to beat the traffic and stress about it. This is something in your control. So if you take that analogy, or that tool is, if it's in my control, let me do something to mitigate that. If it's not in my control, then I'm not going to stress about it. The gut microbiome, we talked about the sugar, which is going to feed the bad bacteria, but the other one you can add to the list, try to minimize any processed food. Processed food means it's going to kill all the bacteria outside, it's going to kill the bacteria inside. The last point is the movement is basically going to help increase circulation. And because you did all the good stuff before, you're going to increase the blood flow to all the stuff that you want to heal, which is the musculoskeletal system, joints, ligament, tendons, and even your bowel, mentation. So you're going to feel more alert. So we'll come to those in details, but those are tips. If you could do one of them every week, you'll be really on a great start, and you'll feel great results after a couple of months.
Yeah. And I mean, ultimately, the goal is that for these conversations that we're having is to simply plant the seed for you so that you can start to think of ways in which you can have an impact on your overall health. Obviously, if you try all of these all at once, it's going to feel incredibly overwhelming. So you pick the one that best resonates with you and do it really well. And you'll start to see all these other improvements. And when that starts to happen, then you actually feel really motivated to do something else, something new. And it just snowballs itself. And it's just, again, the purpose of this is we want to plant the seed and motivate you to get to your health goals.
Totally. I love that point because sometimes people say, well, I can't deal with stress or I can't deal with sleep. That's fine. Pick one of those five, start with it, perfect it. And after 3, 4, 5 weeks, build upon it and move to the next step. So leave the most difficult one till the end. So that way you don't get discouraged. And it's not about the right order. You can start from any one of them. It's going to lead you to the same pathway.
100%. Yeah. Which then leads us to this very interesting sort of phrase here that every time you eat or drink, you are either feeding disease or fighting it. And I have these conversations with myself, and I have these conversations with my patients as well, where especially if there's an emotional eating component, where if you're feeling really low for whatever reason and you go to these comfort foods, sometimes it's totally appropriate because you want that level of nourishment. You want to feel nurtured someplace. But if you can just ask yourself, what is it that's missing in your life that you are trying to replace with food? By simply just asking that question with a little bit of curiosity and with no judgment, but curiosity rather, you start to have this deeper understanding of what's driving your choices in life. And asking that question, I'm about to eat something, I'm about to drink something. Is it nurturing me or is it actually slowing down my healing? And again, asking that with little judgment, but with more curiosity, it's that deeper level of understanding where it doesn't feel like you're fighting against your metabolism the entire time. You're actually being a bit more inquisitive, and your choices by nature are actually going to change by default anyways. So again, ask yourself those questions and do that deeper thinking if it resonates with you.
Yeah, so to add to this point, I love this. And what I do that worked really well with me, before I was disconnected with my kind of organs. So thinking that, yeah, the function of my joint is to help me walk around, the function of my gut is help digest food. But when I came to a deeper thinking to say, my gut system and me are one, and we have to have a dialogue. Am I going to hurt that gut system or I'm going to help it? So let me be on the same side with my gut system. Let me be on the side with my muscular system. And that way you kind of come together rather than you think about it as your employee. And I just kind of toss stuff on it and the body has to deal with it and it fails. Okay, well, too bad, right? We are all one. All the organs are one. So if you think about it that way, honestly, if you think about certain foods that you eat, you wouldn't give it to your dog or cat. Why would you give it to yourself?
100%.
Yeah. So if you think about it that way, because you care about yourself, you're not going to feed yourself that stuff. And because you care about yourself, you're going to feed yourself the right stuff. If you think about it from that different perspective, it's not about that temptation. I want something sweet or something junky. It's basically you have a different dialogue because you love yourself.
Yes. Yeah. I love that. And so this is where we go into the food discovery map. And so here, we're going to get you to log in 3 random days. And so you get to pick 2 of your weekdays. So, you could pick a Monday and a Friday if you wanted. And then you're going to pick one of the weekends. And here you're going to write down what it is you're consuming on those days, and definitely put the time down, because the more accurate you are with this, it will be far more helpful for you in the 3rd week series where we really kind of delve into it. And it's really important that when you're filling this out, you're being completely honest. So we obviously know that when you are being accountable to something where you have to write down what you're eating, you're probably going to even modify what it is exactly you're eating, because you're just like, oh, somebody's going to read this. I need to, like, make sure it looks really good. But be as honest as you possibly can. And we're recording things about what you're eating throughout the day, the timing, but also what you're drinking, how much you're drinking. And Mark, I think you really enjoy using this tool with your patients. And yeah, I think it would be great if you can explain into further detail with that.
Yeah, absolutely. So one of the things that helped me and helped my patients is um, you do it as you go. It's hard to come at dinner time trying to analyze what you ate for breakfast. So literally, I'll stick this next to the fridge or counter, and anytime I put something in my mouth, I'm gonna chart it down, the time and what did I eat, and please don't modify be what you're eating because you're trying to be judged, because this is the real reflection of what you do on day to day. It's not, there's no right or wrong. It's about more to discover what your habits are, and the timing is to figure out where your peaks and valleys, and maybe we need to do some readjustment to help you out with your digestive system. Same with the water. One thing as when you put alcohol or coffee or tea, just put those down as per cups as well. The last point I would like to emphasize, if you do eat out or you have someone who brought you food, you scratch that day, because you really don't know what's in it. If you went to a friend, you went to a restaurant, or you ordered out, whatever it is, you wouldn't know the ingredient and how much it is. We want something that you did at home. So you might skip a day. You have 2 weeks to do 3 days, 2 weekdays and one weekend. So there'll be plenty of time that you decide, I'm gonna chart anything that I eat from home.
Yeah, absolutely. And so I believe Mark will, or someone from Arthritis VIP will connect with you to give it a copy that you can print off. So this is essentially your next steps then. You're going to print off a copy of that food discovery map. And again, you're going to record those 3 days, and you're going to save it for the next meeting, because that's when we are going to take a deeper dive. And again, the importance here is that you're being completely honest. There is no room for judgment here, because if you can't be honest with yourself in that piece of paper, we can't help you. We can't pick out those obstacles that are maybe impeding your journey on this health to achieving your health goals. And so it's just really important that you be really honest. And truthfully, like, I will tell you now, I'm a naturopathic doctor. My Achilles heel, the thing that I love the most is French fries. I probably eat it twice a week. So there's no such thing as a perfect diet, right? There are ways that we can optimize your diet though.
Absolutely. And at the end, when we optimize it, if you do 80% correct and 20% junky, that's okay. But we'll talk about when can you do that 20%. But right now, you just want to discover what you're eating. So just be honest as much as you can, so we can really give you the right advice. Otherwise, you're gonna mess the picture and you're not gonna get the benefit of it.
100%. So last week or 2 weeks ago, we talked about probiotics. And so part of the VIP method is the use of gentian. So if anybody who's currently listening has already used the gentian, you know that it tastes completely disgusting and very bitter and awful, but you probably already know that it works. So how gentian specifically works, you can think of the experiment, the Pavlov's dog experiment, and that's where the psychologist would ring a bell, show dogs food, wait for the dogs to salivate, and then when they salivated, the dogs got the food. So we kept doing this week on week, and finally one day he would ring the bell, have no food present, but the dogs would still salivate. And so this experiment was so famous because it showed you can have you can have a psychological action, which is ringing the bell, which will have a physiological reaction, which is salivation. So in this case, gentian is the bell. Gentian is so incredibly bitter that when it touches your mouth, you immediately start to salivate. And then it sends messages to your brain, which then talk to your gallbladder, your pancreas, your stomach to say, hey, guys, food is on the way. We need to secrete the right amount of digestive enzymes to break the incoming food that's coming essentially. It will also by default, because you've got all these really great juices and digestive enzymes stimulated and working to their best capacity, you're going to get natural peristalsis. So you're going to start to notice, wow, my bowel movements are coming on time. Oh, the bloating that I used to feel all day is like reduced pretty significantly. So as awful as it tastes, it's really important that you think of gentian as a retraining reset button on the upper digestive tract, where if you're really good with taking it on a consistent basis, you're going to help to retrain your digestive organs so that once it sees food, it knows what it needs to do. But if you're very inconsistent with taking it, you're just going to have to be on it for a whole lot longer. So it's like you're prolonging the suffering. So I usually tell patients, just bear with it for 40 days roughly, and you'll definitely see the benefits.
So one point to add, there's a lot of stuff in life that whether we want to do or we need to do. If you want to get help with reducing inflammation, reducing joint pain, increasing mobility, there is some stuff that you really need to do, even if you don't like it. It's only for a short period of time, but if you do that effort right now, you will experience the greater results in a couple of months because you're correcting different systems at the same time. So, but if you want to take it easy from the beginning, you might not achieve the results and you're going to be disappointed after a couple of months and said, you know what, you're still going to feel that bitter taste and you're still going to feel that, hey, it was not fun. But because you didn't take it consistently, you did not get the results. So basically you got tortured without getting the results. So you might just do it on a daily basis, get it over with within 4 to 6 weeks, and you're done with that bottle and get that routine into you. And then the body will kickstart that digestive enzyme.
Yeah, 100%. And I'm not sort of somebody that enjoys watching other people punish and suffer. I've been in practice for 12 years. I have seen this. I've used this multiple times. It's probably one of the most top herbs that I recommend all the time. And it works. It just works so well. And for the patients who stick with it, they very likely never have to do this again in their lives. And it's to the patients that are pretty inconsistent. I'm like, okay, well, here we go. Let's do another round.
Here's the funny part. People ask me, yeah, it tastes very bitter. I said, but you've had shots before, right? There's no benefit to that. But you took it, it's bitter. But at least you know there is an outcome for this one, right? Yes. So if you're willing to do it with a shot, you can do it with this one and know that you're going to get a better result. And I tried it on myself. All this, by the way, all the supplements that we talk about, I try them on myself first. So I can tell you first experience, what they feel, how you take them and so forth. Yeah, after a week, your body get used to it. It's not that bad.
Exactly.
Yeah, it's tolerable.
Yeah. And the last thing I wanted to mention really quickly about gentian is if you take it and for whatever reason, let's say you don't eat, so you get pulled into a meeting or your kids distract you and you don't end up eating, you will feel a warm burning like sensation in the solar plexus region. And that's digestive enzymes working. And that feeling will not go away until you eat. So there's nothing pathological happening. It's working and it needs food to work on essentially. Now on to the next slide with regards to this, just kind of circles back to that theory that, improving your life doesn't have to be about changing absolutely everything. It's really about making the changes that count. And so when we talked it earlier on, of the 5 things or 6 things, pick one, be awesome at it. And then by default, once you've been awesome at it, okay, pick another thing off that list and be really good at it. And that's where the sustainable change happens. That's where the change that changes your life and optimizes your health takes place. So you don't feel like you have to take everything on all at once. That's not the case.
Yeah, definitely do not do all of them at once. You're going to be discouraged, disappointed. Just pick one. You have 5 or 6 different things to do. This program is 6 months. If you perfect one every month, you're going to be doing amazing by the end of the 6 months.
Definitely. And again, what we talked about week 1 with regards to the arthritis is a response to, physical stress, chemical stress, and that emotional stress, and making sure that we are being attentive to those 3 major stressors and And, looking at those sections and seeing which ones resonate with you and asking yourself honestly, like, am I willing to make some changes when it comes to my sleep? Am I willing to make some changes when it comes to maybe excess alcohol? Am I willing to make changes to being mindful of my posture? And again, asking yourself without judgment, but more with curiosity, because when you start to judge yourself for, oh, I sit at the computer and my posture is really bad, and that's a really bad thing, you're very unlikely to make changes that will make you feel good. But if you can ask yourself, well, I notice that I'm really slouching over. I wonder why that's the case. Maybe that might lead to a change where you decide that you might, sit on a yoga ball, or you might do a sit stand desk, or you might notice that when you're standing in the kitchen, I'm gonna, roll my shoulders back and kind of just like breathe into that. Just sort of, it's the awareness that you can really start to make those changes.
So just to comment on this, you're going to see those slides every time we're going to do those bi-weekly presentation. And I'm going to hover the mouse on a couple of things with the physical stresses. Well, injury, you're not going to be able to avoid it if you had it in the past. The only thing is about preventing new injuries. Overuse, it's most likely not in your case. This is for someone who've done the overuse, like construction worker, marathon player, and then they got into this position. But poor posture, sedentary lifestyle, poor diet, smoking, alcohol, chemical uses, and so forth. One thing I want to ask people to do, which I've learned from Tony Robbins, is to ask yourself the right question. Instead of trying to judge yourself about your poor posture, ask yourself, how can I improve my posture? How can I improve my sedentary life? How can I improve my diet? Or what can I do to improve? What can I do to reduce smoking? If you ask those positive questions and only need to do one change every 2 or 3 weeks, one little thing, right? And one of those examples about the chemical use, I had this patient who'd been using 10 liters of pop per day. Kid you not, 10 liters of pop per day. And she's very tiny. She doesn't eat. Her food consists of maybe one bagel a day because she's always full. She's always jittery and hyperactive because of all the caffeine in it and all the sugar as well. It came to about 600-700 grams of sugar per day. The deal was, I want you to reduce 1 liter every month. And she said, that's it, or I can do better. I said, I don't want you to do any, otherwise you're gonna bounce. We're into month 7. Right now, she's down to 2 liters of pop. But now her food intake increased to 3 times a meal, 3 meals per day instead of 1 meal per day. But this became more of a habit rather than just cutting it. So it takes a long journey. You didn't go to 10 pops or 10 liters per day overnight. It's going to take you some time to go backward to the other extreme, right?
Yeah.
So yeah, ask yourself the right question, and you'll find the right result and right answer for it. And if you have a question with it, ask us. That's what we're here for.
Absolutely. Yeah, I love that. And I also think, when you ask the questions, those inquisitive sort of questions without judgment, that's what leads to sustainable change. Yeah, and that's what keeps you healthy. That's what keeps you able to achieve the goals that you want to achieve. So yeah, I think that's beautiful.
Good. So that takes us to the end of this session. And regarding the Q&A, we had all those questions throughout, and I don't see any more question at this point. If there is any question, write them down, hold them to the next meeting, and we can readdress that with the next session. That's going to be 2 weeks from now on Monday, 7 p.m. Eastern time.
Amazing.
Awesome. Thank you very much. Thank you, Dr. Crystal, for joining us and give us your insight. And have a great evening.
Yeah, you too. Take care, everyone.
Bye.
Bye.